everyone. I'm Karkinos Healthcare Northeast Pvt. Today we speak about a word that quietly frightens every family: cancer. For years in our state, hearing that word meant something else too: packing a bag and traveling far. Maybe Guwahati, Kolkata, Vellore, Mumbai, Delhi, often for months and often at a cost that burdened families. Akoina cancer haiba wahise tabu matamda yamna akitu jungba phawba family gi singi damakti yamna nungaitaba aduna imungda cancer nare haibase yawbo taragadi Manipur gi mapanda kari lamda chatkadori bano Vellore da chatkadra Kolkata chatkadra Guwahati Mumbai Delhi da chatkadra karamba doctor da tanagani karamaina layengani aduga magi sales yam tingna mapana chalaga layengani haibagi adukumba yamna mi paiba adukuma wahini cancer haibasi adubu masi adum ahongba matamgi matungina ahongba lagle. This is beginning to change. Aduna ngasi ngasi mag Imphal gi mayol da lairiba Karkinos Cancer Hospital da koi expert doctors mayam ma leire cancer lying lying pathap chatha duna cancer nariba miambu moibu cancer patients in the care pi duna moibu lying pathap chatha duna moi punsi yam nungai na treatment pi duna minor treatment lying pathap chatha duna leire duna. Today we have doctors, specialist doctors caring for cancer patients right here in Imphal at Karkinos Cancer Hospital. Let me take the opportunity to introduce them. First, we have Dr. Thangjam Nirpendra, a consultant radiation oncologist with over a decade of experience in oncology care, radiation therapy, and cancer management. Holding an MD in radiotherapy, he has served in key clinical and public health roles, contributing significantly to the delivery of cancer care in Manipur. Welcome, doctor.
Thank you.
We also have with us Dr. Pallavi Mehta, a senior consultant in clinical hematology with expertise in bone marrow transplantation, CAR T-cell therapy, and advanced cellular therapies. A DM in clinical hematology from Christian Medical College, CMC Vellore, and having practiced at Rajiv Gandhi Cancer Institute, Fortis Memorial Research Institute, Narayana Multi-Specialty Hospital, and Max Hospital. Dr. Pallavi specializes in the management of blood cancers as well as complex non-malignant blood disorders. Welcome, doctor. Mathangda, we have Dr. Thingujam James, a consultant gynecology oncologist with specialist expertise in the surgical management of women's cancers, including ovarian, cervical, and uterine malignancies. He holds a fellowship in gynecological oncology through the Association of Gynecological Oncologists of India. Dr. Bursu Taram Nokchari. And last but not least, we have with us Dr. Konzam Jeena Devi, a consultant anesthesiologist and critical care physician with over a decade of experience in intensive care medicine, anesthesia, and perioperative care. Holding an MD in anesthesiology and advanced training in critical care PDCC, she has been instrumental in managing complex and critically ill patients across tertiary healthcare settings. Dr. Bhusutaram Nokchari. So we have all the experts, doctors from Karkinos Cancer Care Hospital with us today. We'll be discussing about what is cancer, and we'll be busting some myths about cancer, as well as we'll be talking about treatment facility available for cancer patients in Manipur, here in Manipur itself. To begin with, let me come to Dr. Thangjam Nirpendra. Doctor, akoina cancer haibasi ta matamda yamna kiba aduga magi lying pathapse kamain chathagani Manipur gi mapana chatpa taragani sel tingba karma doctor da approach togani haibai gi sukumba yamna worry myam lei. So but cancer is the same disease everywhere, whether it's in Manipur or in other parts of the country or the world. Aduna, why Manipur needs its own answer to cancer?
Thagachari. Question si akogi cancer gi har ko matam dadi cancer gi scenario si Manipur ga atopa India ga te passing si ge yeng matam da kadang khena bakra lek akogi Manipur si picture aga su cancer gi incidence prevalence that they amna wang leiba makam mafam amoy India gi not only India ako India ka tangna tabida Prithvi ko ni yang matam da globally if you look into it not is ako na cancer hub pa na khangnare mo
India gi oina
all over the world yang matam da ko ndagi kan India gi oina so the Prithvi gi cancer scenarios yang matam da not is the cancer makal khara lei which is like quite gi yamna phangba mafum khara koi not is the su lei yeba advain tawdana Manipur sisu cancer not is ki part ma ojaraga so cancer gi incidence there is the masim akal se amna wang lei not koi gi India gi yang matam da South India koi gi southern side there is the cancer makal khara lei adudana yamna rare oina leiraga koi gi northeastern India there is the especially Manipur Nagaland side there is the yamna hana common oiba samna da koi gi naton gi maning thangba jaga da leiriba nasopharynx ka hariba si akoi gi yamna akoi gi Manipur state se yamna magi kano se cancer gi chang si ang bol adudagi akoina amuk akogi chariba chinjak andagi hoskin naha singchina tobacco season na hidak mana season na ba churup season na pa khaini andagi akogi asai talab kai season na mayam singchina siga mari dainana akogi siga thokna ba ya thokpa ya ba cancer makal khara haigadi oral cancer ko lai cancer khanau gi manungi cancer andagi akogi food pipe ki cancer gastrointestinal tract chakhau gi colon sugumba mayam si akogi Manipur state yam chang yang wang ndigi nupi rom da haraga su akoi angang khau machin gi cancer cervical cancer breast cancer mo si chang yang wang kano to bus is da ta ya yang no matam da su ko aduga project akoi gi demographic profile da natraga akoi gi patients sing si gi socio economic condition da yang ura gadi Manipur si yam sothana leiriba patient sa gi lam da si yam sothana leiriba mafam ma oibani aduna akoina anaba sina cancer ama nare haina diagnose to ko matam da moi gi wakal sida leidu si thaina de gi hana mitrama haza wakal da ma leije cancer bu naraga di akoi si layang bang amaroi paisa yam chang balaina amani aduna akoi si layang na bu hana da yum calls mai tum na noi manga do ri ni hana wakal sugum mayam su leinai si leitabna te matam khargi mamang da sahi khargi mamang da di akoi cancer si nare ha matam mapan da chatlaga Delhi da andagi Mumbai da Tata da chatna ko mayam akoi cell ting na chatna rameva aduna treatment si akoi nare ha matam da mapan da chatpani na akoi leijaramba paisa nun tumba andagi lying du da natana akoi chatpada matom da chatpa yadam ne ma ge family members kara hoga chatkani mari mata kara yaw chakani ada leiruba matam da chana ba thakna ba mayam sina mayam to matam da andagi language ki barrier ama leiba wa ngang ba akoi mi khara khatani akoi mapan gi akoi Hindi khangde English khangde amna fluently ngang ba understand to bangam mi se adu khara am mi khara amadi si paw si thinwai na phawna bangam da ba adu adugumba barrier mayam do leibani na akoi gi Manipur gi scenario siga mapan na tholaga lei matam da mapan gi di akoi gi metropolitan cities site are ko Delhi Mumbai mo sing stay yang matam da di mo si they are more affluent pesanang sa hana mo ne lei andagi lonely hare mo ne hana khangna bi heli ko aduna mo gi asona kan da tor ko treatment si akoi sida direct inteto por ko su ya de aduna cancer gi treatment si su akoi Manipur gi scenario da di Manipur khatang gi wana te cancer treatment of gi ha tar ga is going to be more of individualized mi gi matung in na akoi na noin individualized of da ka
my family condition so yang alda
yes ana khudamoi na haraba da hujikti ano treatment mayam la iko cancer gi si immunotherapy kana ga lai ba sugum sing si hujikti hujiki wena di amna tangi expensive oi adana kara sesor paisa nung sa khadana leijada ba mi sing si moi se afford to bungam da su dum yaoi ba adana si sing si yenguraga akoina more individualized treatment amda ka le
aduna more individualized treatment darka tabne na Manipur gi patient gi singi damakta more individualized customized oiba adugumba treatment tangai fade hen thambi bani adagi doctor dagi khangjaning baje hojikti hanam hoi mapa yam chatlamba hojik train je hongak pagi train je sum akoina ju ujarak pa haiba tare haibadi Manipur makta da hojik Karkinos Cancer Hospital smain leire big facility building Porampata campus smain leire aduga expert doctors me am leirabni na mindset je han mapa na chatragadi akoi treatment lying baze yaroi having mindset da hongba change ama lakpa thengna bibra doctor
chumi akoi gi hana chahi khara gi mamang da di akoi Manipur state da particular akoi gi cancer gi oiba akoi gi lying pham si mapung pha ba hai tare ga si kya leiram de ꯍꯥꯟꯅ ꯂꯩꯔꯝꯃꯤꯁꯤꯗꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯃꯩ ꯌꯥꯏꯕꯒꯤ ꯗꯣꯛꯇꯔ ꯑꯃ ꯇꯣꯉꯥꯟꯅ ꯂꯩꯔꯅꯤ, ꯁꯔꯖꯔꯤꯒꯤ ꯇꯣꯉꯥꯟꯕ ꯑꯃ ꯂꯩꯕ, ꯑꯗꯩ ꯀꯤꯃꯣ ꯄꯤꯕ ꯇꯣꯉꯥꯟꯅ, ꯑꯗꯩ ꯃꯐꯝ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯅ ꯅꯣꯏ ꯆꯥꯏꯊꯣꯛꯑꯒ ꯂꯩꯕꯅꯤꯅ ꯄꯦꯁꯦꯟ ꯑꯃꯅ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯒꯦ ꯍꯥꯏꯇꯥꯔꯒꯗꯤ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯅ ꯃꯐꯝꯁꯤꯗ ꯆꯠꯄꯗ ꯃꯣꯏꯒꯤ ꯑꯋꯥꯕ ꯀꯌꯥ ꯑꯃ ꯊꯦꯡꯅꯩꯌꯦꯕ꯫ ꯑꯗꯒꯤ ꯑꯇꯣꯞꯄ ꯑꯃꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯕ ꯃꯇꯝꯗ ꯗꯣꯛꯇꯔ ꯑꯃꯒꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯣꯑꯣꯔꯗꯤꯅꯦꯁꯟ ꯑꯗꯒꯤ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯅꯕꯒꯤ ꯃꯇꯥꯡꯁꯤꯗꯁꯨ ꯈꯔ ꯋꯥꯠꯄ꯭ꯔꯥ ꯍꯥꯏꯅ ꯈꯜꯂꯤ ꯍꯥꯟꯅ ꯃꯃꯥꯡꯗꯗꯤ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤꯀꯣ ꯁꯦꯝ ꯔꯨꯞ ꯑꯃꯗ ꯂꯩꯇꯕꯅ ꯑꯗꯨꯅ ꯑꯗꯨꯒꯤ ꯃꯌꯥꯝꯁꯤꯡꯗꯨꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯄꯦꯁꯦꯟꯁꯤꯡꯁꯤꯅ ꯍꯦꯛ ꯃꯄꯥꯟꯗ ꯆꯠꯂꯒ ꯂꯥꯌꯦꯡꯕꯁꯤ ꯃꯣꯏꯁꯤ ꯑꯩ ꯉꯁꯥꯏ ꯃꯃꯥꯡꯗꯁꯨ ꯄꯟꯖꯈꯤꯕ ꯗꯥꯏꯒꯅꯣꯁꯄꯨ ꯇꯧꯔꯒꯗꯤ ꯀꯦꯟꯁꯔꯅꯦꯕꯨ ꯍꯥꯏꯔꯒꯗꯤ ꯃꯄꯥꯟꯗ ꯆꯠꯂ ꯂꯥꯌꯦꯡꯒꯗꯕꯅꯤ ꯍꯥꯏꯕꯒꯤ ꯊꯥꯖꯕ ꯃꯤꯠ ꯑꯃ ꯑꯗꯨꯝ ꯂꯩꯔꯝꯃꯦꯕ꯫ ꯑꯗꯨꯕꯨ ꯍꯧꯖꯤꯛꯇꯤ ꯃꯗꯨ ꯑꯍꯣꯡꯕ ꯐꯅ ꯌꯥꯝꯅ ꯂꯥꯛꯑꯦ ꯍꯥꯏꯅ ꯈꯜꯂꯤ꯫ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯏꯠꯁꯦꯜꯐ, ꯑꯩꯈꯣꯏ ꯀꯥꯔꯀꯤꯅꯣꯁꯤꯁꯨ ꯃꯥꯒꯤ ꯁꯦꯝ ꯔꯨꯐꯇꯨꯗ ꯑꯩꯈꯣꯏ ꯁꯔꯖꯤꯀꯦꯜ ꯑꯣꯡꯀꯣꯂꯣꯖꯤ, ꯁꯔꯖꯔꯤꯒꯤ ꯑꯣꯏꯕ, ꯔꯦꯗꯤꯌꯦꯁꯟꯒꯤ ꯑꯣꯏꯕ ꯃꯣꯔ ꯑꯦꯗꯚꯥꯟꯁ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯑꯦꯗꯚꯥꯟꯁ ꯑꯐꯕ ꯃꯈꯜꯒꯤ ꯈꯨꯠꯁꯨ ꯈꯨꯠꯂꯥꯏ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯒ ꯃꯩ ꯌꯥꯏꯕꯒꯤꯀꯣ ꯑꯗꯨꯗꯒꯤ ꯑꯃꯨꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯍꯤꯃꯥꯇꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ, ꯂꯤꯀ꯭ꯌꯨꯃꯤꯌꯥꯒꯤꯀꯣ ꯕ꯭ꯂꯗꯀꯤ ꯑꯣꯏꯕ ꯀꯦꯟꯁꯔ ꯁꯤꯗꯁꯨ ꯂꯣꯏꯅꯃꯛ ꯄꯨꯂꯞ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯌꯥꯔꯕ ꯑꯗꯨꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯥꯏꯒꯅꯣꯁꯇꯤꯛ ꯐꯦꯁꯤꯂꯤꯇꯤꯁ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯔꯦꯗꯤꯑꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ CT, MRI, PET scan ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯊꯣꯂꯣꯖꯤꯒꯤ ꯄꯥꯔꯠ ꯅꯣꯏꯅ ꯃꯐꯝ ꯑꯃꯗ ꯄꯨꯂꯞ ꯂꯩꯔꯕꯅꯤꯅ ꯄꯦꯁꯦꯟꯅ ꯂꯥꯛꯑꯒ ꯂꯥꯌꯦꯡꯕꯗ ꯃꯐꯝ ꯀꯣꯏꯆꯠ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯗꯨ ꯂꯩꯔꯔꯣꯏ꯫
ꯁꯤꯡꯒꯜ ꯔꯨꯐ ꯂꯣꯏꯅꯃꯛꯁꯦ
ꯁꯤꯡꯒꯜ
ꯂꯩꯔꯦꯕ꯫
ꯔꯨꯐꯇ ꯄꯨꯂꯞꯇ ꯅꯣꯏ ꯂꯩꯔꯕꯅꯤ ꯑꯗꯨꯅ ꯄꯦꯁꯦꯟꯅ ꯃꯥꯅ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯁꯨ ꯂꯩꯔꯔꯣꯏ ꯄ꯭ꯂꯁ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯁꯦꯟꯗꯁꯨ ꯄꯦꯁꯦꯟꯗꯨꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯀꯔꯤ ꯇꯧꯒꯗꯒꯦ ꯀꯔꯤ ꯂꯧꯈꯠꯀꯗꯒꯦ ꯍꯥꯏꯕꯁꯦ ꯑꯩꯈꯣꯏ ꯃꯁꯦꯟ ꯗꯤꯁꯀꯁ ꯇꯧꯅꯔꯒ ꯀꯟꯐ꯭ꯌꯨꯖꯟ ꯑꯝꯇ ꯂꯩꯇ꯭ꯔꯦꯕ꯫ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯑꯃꯅ ꯌꯥꯝꯅꯁꯨ ꯃꯔꯨ ꯑꯣꯏꯕꯀꯣ ꯀꯦꯟꯁꯔꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯣꯔꯗ ꯐꯝꯕ ꯍꯥꯏꯁꯦ ꯃꯄꯥꯟꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯡꯗ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯝ ꯇꯥꯔꯝꯒꯅꯤ ꯇꯥꯇꯥꯗ ꯆꯠꯄ ꯃꯇꯝꯗ ꯃꯣꯏꯗꯤ ꯕꯣꯔꯗ ꯐꯝꯃꯤ ꯍꯥꯏ ꯕꯣꯔꯗ ꯐꯝꯕ ꯂꯣꯏꯔꯀꯥꯟꯗ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯗꯣ ꯍꯧꯋꯦꯅ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁꯇ ꯃꯁꯤ ꯌꯥꯝꯅ ꯃꯔꯨꯑꯣꯏꯕ ꯑꯩꯈꯣꯏ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯒꯤ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯁꯤ ꯂꯧꯋꯤ ꯑꯦꯕ꯭ꯔꯤ ꯄꯦꯁꯦꯟ ꯈꯨꯗꯤꯡꯃꯛ ꯂꯥꯛꯄ ꯈꯨꯗꯤꯡꯃꯛ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗ ꯂꯣꯏꯅ ꯐꯝꯃꯤ ꯕꯣꯔꯗꯁꯤꯗꯩꯁꯤꯗ ꯇꯧꯔꯤꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃ ꯃꯥꯒꯤ ꯐꯤꯜꯗꯨꯗ ꯍꯦꯟꯅ ꯈꯪ ꯍꯩꯔꯕ ꯃꯌꯥꯝ ꯑꯃ ꯁꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯃꯅꯨꯡꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯌꯥꯝ ꯑꯃ ꯌꯥꯎꯔꯅꯤ ꯗꯣꯛꯇꯔꯁꯤꯒꯤ ꯑꯩꯈꯣꯏ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯒꯤ ꯅꯠꯇꯕ ꯃꯄꯥꯟꯒꯤ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯑꯇꯣꯞꯄ ꯄꯥꯔꯠ ꯀꯥꯎꯟꯇꯔ ꯄꯥꯔꯠ ꯀꯥꯔꯀꯤꯅꯣꯁꯀꯤ ꯑꯣꯏꯕ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯌꯥꯎꯒꯗꯧꯔꯤꯅꯤ ꯄ꯭ꯂꯁ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯑꯣꯏꯕ ꯃꯣꯏꯁꯨ ꯑꯗꯨꯝ ꯌꯥꯎꯔꯤ ꯑꯗꯨꯅ ꯄꯨꯂꯞꯁꯤ ꯑꯩꯈꯣꯏ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯃꯜꯇꯤ ꯗꯤꯁꯤꯄ꯭ꯂꯤꯅꯔꯤ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯚꯔꯆꯨꯋꯦꯜ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯍꯥꯏꯅ ꯍꯥꯏꯀꯣ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯄꯨꯂꯞ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯀꯦꯁꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯊꯥꯡꯗꯣꯛꯑꯀꯥꯟꯗ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤꯅ ꯁꯤꯅꯤ ꯁꯤꯗ ꯁꯤꯒꯤ ꯏꯟꯚꯦꯁꯇꯤꯒꯦꯁꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯁꯤ ꯐꯪꯉꯤ ꯃꯥꯒꯤ ꯂꯥꯏꯑꯣꯡꯅ ꯁꯤꯅꯤ ꯍꯥꯏꯕ ꯃꯌꯥꯝꯁꯤ ꯂꯣꯏꯅ ꯄꯨꯊꯣꯛꯑꯒ ꯄꯨꯂꯞ ꯅꯩꯅꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯅꯥꯕꯁꯤ ꯃꯥꯒꯤ ꯆꯞ ꯆꯥꯕ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯁꯤ ꯑꯣꯏꯔꯅꯤ ꯁꯤꯗꯩ ꯍꯧꯔꯁꯤ ꯍꯥꯏꯕꯁꯤ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗꯁꯤꯗ ꯗꯤꯁꯥꯏꯠ ꯇꯧꯅꯩꯌꯦꯕ ꯑꯗꯨꯅ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯜ ꯑꯃꯈꯛꯀꯤ ꯗꯤꯁꯤꯖꯟ ꯉꯥꯛꯇ ꯑꯣꯏꯗꯦ ꯑꯗꯨꯅ ꯁꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯍꯧꯕꯒꯤ ꯑꯣꯏꯅ ꯁꯤ ꯗꯤꯁꯤꯖꯟ ꯃꯦꯀꯤꯡꯁꯦ ꯁꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯁ꯭ꯇꯦꯞꯅꯦꯅ ꯑꯩꯈꯣꯏ ꯂꯧꯖꯩ
Thank you, Doctor. Aduna Karkinos, it's not only Manipur Katangnati, it's national level, international level, the experts mayam yauraga, adumaina chain ama cancer care gidamakta aduguma leba hospital network ama oibanina. Aduna any patient Manipur gi cancer care Karkinos hospital lakpa matamda mogi lying pathapse kamain sathagadage habse expert mayam zigi board adumaina meeting phamaga best treatment options locally have to doctor and thambibani mathang ne hai doctor thingujam James lakchage doctor akhona cancer ji my last stage to go ita di akhona best option pi bataraga su magi lying pathap sidi kitang di why have challenges me am le du but akhona yam nganna screen da hobo taraga di khangdo hobo taraga di lying pathap sathaba da yamna lie haiba se doctor experts sing hanjan adum haiba wafam ni but today's the awareness is adum khara de dum wat pra cancer haiba taraga di changu hospital da changu gadawo kitang ki bo phawba duga cancer ri ai screen ga tawba chatpa je ai ji cancer narak torebra haibagi ki bo phawba swai je kitang myth amalai je khara bus tawbiu aduga early screening gi importance se khara highlight tawbiu doctor
hoi yam chum wa kham ne akoina cancer bu hair di mayam je ki ba hai tare adagi keno tawba se loin tawne yam man kayo de cancer bu nar ga end stage ne na mayam loin khang ne to khanei hai tare ko aduda akoina tawba se usually screening hai akoina hai je cancer je detect tawge have na te akoina screening hai se sengna hai ragadi akoina screening tawba se mi khara na ju mai na ri moi masan as akoi de na ba yaude akoi de symptom kai gum ta leite adune screening tawba gi atha thokte kote na hai ba se mai nei ado main purpose for screening the anabada screen anabada tawgadab natte nadriba mi do ado screening tawgadab ne haibagi atradi akoina screening je tahuk targa di ngallingai da samna haida kan the example oina cervical cancer gi screening hai nangang khau muchin gi se si se akoina screening tahuk targa di kamain to ga kan da magi changes ama haibagi atradi cancer di yodriba pre cancerous state haitare cancer maksu yodriba cancer da gi normal da gi kitang lanjal laba haitare sigi mafam sida akoina thengna huk tar ga di icham chamba procedure am tawraga yam kuidaba haitare ko procedure macham tawraga sidagi sig laying pathap te tawraga mangon da gi haiba cancer ji olhandana ba treatment je tawbanga me haitare aduga mayam gai da ju akoina screening tawse hai se akoina cancer do yeng kanda ma se cancer do diagnose tawra kanda cancer treatment do tawga have natte akoina hai at least cancer do on drangai prevention hana tahusi haiba gi wakolon ni adu mayam da ju akoina awareness mayam ju pire adu ai ju mi gai ji kitang reluctant oiba hai tar
hostile oiba individual ju thengnarakpra sigi matang
kai do ba
hostile oiba kitang sauning buga pawba
gi thengna ye moida samna kanda akoina akoina field daga chatlaga akoina awareness akoi Karkinos se dum continuously adum field da chatlaga adum akoi awareness piba adagi screening piba se screening to wai di akoina khuju khlai pu dharaga makhada ada angang khaugi machin gi test to wa adagi breast se kamai to examine to ni ga moy tak ba amasung akoina akoi gi doctor chatlaga moy examine to raga to bu matam sida mi khara tholak pa yaure tholaga su akoina the minus screening to se hai matam the hector saurak paga su yawe kai doi to doina to roi gain haiba mi kharam di harau na hai di smai to re dui di to thok si hai da harau na adu di akoi to thok sage hai ba su konga am yawe adu bu akoina thengnar bu matam da hostile oi ba su dum yaw da natte yawe hai tare aduga
they adu minus hostile oiba or kanos minus screening to the kizaba mioi sing the kari paujil di thamining bage doctor
paujil hai taragadi sengna hairagadi akoina nupi oibida main oina screening tawbase cervical screening semdi niyom chuma tawbo phai kaigino hai je akoina screening tawse hai je aina pame akoi Karkinos na pame haraga tawse hai natte all over world da chatna biduni tawse hai se kaigino hai tai akoina khange cancer se up to some extent preventable ni haibase haibadi preventable ni haibdi nganna khangau taragadi adu nganna khangau taragadi treatment je phajana tobi taragadi at least icham chamba procedure macham tawga pre cancerous condition da thengna hu taragadi maje outcome yam phajayena adu na tabida phajana full blown cancer ga taraga laku matam da treatment tawdaragadi emotionally financially family gi oiba paisa ju changba amu tawba oiba adu mathak tong outcome ju akoi pre cancerous ka yengu matam da cancer ga yengna matam da pre cancerous na outcome jam phajabani na akoina mangjong na treatment taw mangjong na akoina screening ta hok taragadi masi yam kanagani aina khanse
dai doctor akoina national level gi data yang pamatam aduga Manipur gi data yang pamatam da yamna khena baje leibra doctor gi personal experience hoje Karkinos Imphal da thabok to matam da mayam thengnarak pada unique oiba Manipur gi scenario ju khara thambina ba haizari
lei haiba gi athis usually akoina Manipur da yengo matam da as cancer per se da hai matam da akoi Manipur da na samna kan head and neck kumba cancer or otherwise esophagus kumba nupidan cervical cancer ke kaje more haita yamna ui haita akoi gi Manipur da se ayamna jo tobacco gumba chaba khotpa sidagi ayamna oigadra na khalle adu akoina sida Karkinos suppose cancer nare hairaga laaga jo akoina se samna kan da screening taw la diagnosis taw matam jo first akoina usually patient amasung patient party da akoina experience hai taragadi usually moi the patient party the break hek nuai ta pau hai tarene break to khotpa to je sudden break to na matam khar lauraga moi da hai tare patient da smile tawraga nangi disease is mind tawre cancer is mind tawre hai poto magi condition laiyong amasung stage se ka dun yom chumna takpi ba hai tare sidadi kitang di phabra na khalle ina ai wakhanda
Thank you so much, Doctor. Matang ashwada attend ba commercial break lawjagi break matung da we have two more expert doctors adagi moidagi cancer laina sigi matang aduga treatment facility gi matang
ꯄꯤꯔꯛꯑꯣ ꯑꯩꯈꯣꯏ ꯃꯇꯦꯡ ꯁꯣꯏꯗꯅ ꯄꯥꯡꯖꯒꯦ
Break ki matungda amka hana taram nokchari. After the break, I would like to come to you, Dr. Pallavi Mehta. Doctor, when we talk about blood cancers, leukemia, lymphoma, and bone marrow transplants, these are treatments families in our state always had to travel outside, long distance to get the treatment. So could you please tell us plainly what a blood cancer transplant is and how this advanced care is finally available right here in Manipur?
So thank you for such an important question. It's a really an important question, and with this question I would like to tell everyone to remove their fear of blood cancer. So most of the patients, they are thinking that having a blood cancer is like a death sentence. But nowadays having a blood cancer is not like a death sentence. We do have a cure for many blood cancers. Patient can live a normal quality life and patient can have a long-term disease control. So first of all, we should burst this myth that having a blood cancer means that patient will eventually going to die within a few months. So for blood cancers treatment, we usually do chemotherapy, and for most of the patient, chemotherapy is enough, but not all the patients chemotherapy will be enough. So in those cases, we decide, depending on the indication of the blood cancer, we decide which patient will need bone marrow transplant. So in a common term, we call it bone marrow transplant, but in a medical term, it is actually the stem cell transplant. We do not take the bone marrow cells from the donor, we just take the stem cells. And the process of stem cell donation is not like a surgical procedure. It is just like as simple like donating blood and platelets. So most of the donors, they are afraid of donating stem cells because they think that it is like a surgical procedure. They will have to undergo big surgical procedure under GA. So they are reluctant to donate your stem cells. So it's just a simple process. We can donate stem cells just like we are donating platelets. Okay? So in a bone marrow transplant, what we do exactly is we eradicate the diseased bone marrow of the patient. So I'll tell you the concept, what is exactly the bone marrow transplant. We eradicate the diseased bone marrow with the chemotherapy and the radiation. We make the space in the bone marrow of the patient so that the stem cells from the healthy donor can be transfused to the patient. And the transfusion of those stem cells is also just like a blood transfusion. It's not a surgical procedure. We are not taking the patient in the OT. We are not doing any big surgeries. It's just like a simple blood transfusion. We can infuse the stem cell, healthy stem cells into the patient. And those healthy stem cells will eventually make the normal blood cells, like a normal hemoglobin, normal platelets, normal WBC, and a normal immune cells. So these immune cells will prevent the relapse of the disease for the rest of their lives. So this is the basic concept of stem cell transplant. Now the question is, who could be the donor for these kind of patients? So the donor mostly is in the family members. So your brother, your sister, your parents, mother, father, even your grandparents, even your children, even a children as small as 1 year old can be your donor, stem cell donor. And it depends on the HLA typing. There's a test called HLA. We do the test. It is just a normal blood test. And after checking the HLA typing, we determine as a hematologist, we decide that which is the best donor for that patient, and we take that donor for the stem cell transplant. So this is the process of stem cell transplant, but it is not an easy process.
It's not an easy process, but doctor, you're saying all this facility, this testing process, this treatment facility is already available here at Karkinos in Imphal.
Yes, so we have all the diagnostic tests which is required, the transplant. We have the expertise also. We have a doctor, like I have joined as a hematologist here. So in that sense, we have everything here, and so we need to now select the patients. So patient selection is also very important. We now need to screen the patient. We now need to make patient aware that this facility is available in Karkinos. So that patient should be aware whether his disease needs transplant or not. Most of the patients, they don't even know whether their disease, the hematological disorder which they are suffering from, they need transplant. So first of all, our vision at Karkinos is to develop a good hematology services and make people aware of the hematology and guide people whether their disease needs transplant or not. So that is our basic aim right now. And in the near future, we are definitely going to start our transplant unit so that we can do both autologous and allogenic stem cell transplant, so that people don't have to travel to the faraway places. So till now, people are traveling to Delhi, CMC Vellore, and because this is not a one-step treatment. it needs a long follow-up, even up to 2 years sometimes. So staying Vellore or Delhi,
Out of
Kolkata for
station
2 years
is-
is impossible. It is exhausting mentally, physically, financially, and emotionally. And sometimes patients do not follow up to these places and they come back to home. And the things get complicated, then all the hard work which they have put in the transplant is just wasted because the follow-up was not the proper thing. So that's why we need Northeast state of India needs their own transplant unit, their own hematology center. So that is the basic vision we have at Karkinos right now, to start a transplant unit so that patients do not have to travel to faraway places and they get the standard evidence-based protocols which they are getting at the Vellore. The same treatment they will get here, but at the ease of being at home with the family, because after all, at last, home really matters. It really matters that patients should stay with the family members, and because it's a lifelong treatment. So yes, so that is our basic target and aim to start hematology.
Thank you, Doctor. Doctor, na tapu baze hozik blood cancer masigi lai pathap si jo koi Manipur da Karkinos Hospital da magi loimak treatment sigi expertise mayam lai rehan takpi bani aduga masi long term treatment oiba aduga stem cells na chingba magi treatment mayam ma lai baze se is expertise mayam lai re process mai tauba ya badi mayam lai re aduga karigumba patient amana Manipur gi wang ma da sat pata ga ting masi long term oiba adukumba treatment method chahi ani hum changna mapanda lai badudi patient ki damukta so awaba mayam ma thengnarakadoriba aduna sigumba mayam treatment facilities ya koi Manipur da lairabanina Manipur si matang da public na awareness se leiba taragadi Manipur da dum treatment chathabada patient ki damukta su khudong chada ba mayam leibadu hanthan bangam gani family ki damukta su khudong chada ba mayam hanthan bangam gani hadi mapana sapadi yamna challenges miyam like doribnina aduna sigi awareness se leiba taragadi sida dum inak nagna yum manakta inak nagna smaina facility miyam je khudong chaba lawi ba yagani habegi doctor gi admaina doctor na thambi bani. Doctor, I would like to ask another question. When a local patient receives a complex diagnosis, how does Karkinos digital backbone ensure they receive the best possible treatment plan without having to fly to metropolitan city?
Sure. So this is also an important question because now this is the digital age, and at Karkinos we always tell it's a technology-driven healthcare system. So firstly, we need to understand whenever a patient has been diagnosed with a cancer, so it is such a difficult time for the whole family. Not even the patient, it's a very difficult time even the family to go through the whole journey of the treatment. And every patient deserves to have evidence-based standard protocols without any compromise in the quality care. So we at Karkinos believe in this concept to provide health care which is evidence-based and protocolized, and every patient, irrespective of their background, they should receive that standard treatment. So that's why we have developed a digital platform, and we utilize this digital platform a lot in the form of a virtual tumor board meeting. So none of our protocols are just like a physician's personal opinions. So we usually have a virtual tumor board meetings regularly, where we connect our local doctors here in Manipur with the experts who are working in the leading centers of Delhi and even in the abroad as well. We connect with those experts who are working as a very experienced doctors in their field. We discuss each and every case in details, fine details, and we consider all the multiple factors, even related to their financial factor, their social factors, and then we customize the protocols depending on the patient scenario. We tailor-make their protocols so that patient gets the best standard protocol and without compromise on the quality. And patient doesn't need to go to Delhi, Vellore, and to big places to get the same treatment there, because we are also following the same treatment protocols. The quality is same. So we can assure patients that even in the comfort of their home, they are getting the best treatment possible. Because as I said earlier, home really matters in the case of cancer patients, and staying with the family and staying at home, it really matters.
Thank you, Doctor. Doctor, tapu baze hozik digital era zo area duna Karkinos ki magi digital backbones raise the haidi magi international level the leba national level leba experts mayam je tanaraga patient magi treatment je lying pathap satha bada mayam je hojikti digital era zo mayam je connect tawraga tato tashin tawraga best treatment option patient ki damakta the minor doctor singna decide tawe hena ꯊꯝꯕꯤꯕꯅꯤ thank you so much doctor makha tarakpada doctor konjam jina devi lakchagi doctor akhoi cancer gi treatment je ma je yamna araiba treatment dina tamina sel yam changba aduga especially for family coming from lower income even for everyone it's a very expensive treatment aduna financial gi burden cities masi kamaina yengbi yabage aduga here at Karkinos for families facing financial constraint aduna mogi cancer patients singi damakta any special package swize khathambi
I just want to come again. I am a cancer patient last person of which the Koi Manipur gi people see and almost I am economically young people soap I am like go. Adagi ho economically stable over so like the cancer gi lying pathapasida treatments is hang chathaga delivery go. Masida koi head diagnose to padeki ko koi diagnosis teki however treatment chathabagi me am sida sales nungsu am changi ko. The imung munung smile high ne koina cancer ki treatment over the patient nothing imung munung pu yauna treatment to delivery habidi magi psychological ko the social economical ko gi loina maksi drain to ka delivery na akoi gi Karkinos ta koi Ayushman Bharat PMJ gi facilities available oje adagi koi gi chief minister gi haksel gi tengbang hai tare ko CMST card si pa koi dum patient gi package dum lo yause starting from gi koi gi diagnosis ki keno tong na ba test nung to bu khot pa ko adagi treatment chatharapa whether it be surgery gi wagera adagi chemo ka po wagera radiation gi wagera ko si haksel gi tengbang gi group hai tare ko ki PMJ ga keno ga sida chief minister gi haksel gi tengbang da loina coverage PB hai tare adagi amana koi gi third party administrator insurance ki sisu on the process the delay je
Okay.
masi hai ga thamje
samna harbada ji Karkinos cancer hospital je empanel for PMJY aduga CMHT aduga insurance ki ju
insurance ki so
other way my lady have doctor makhada na khangjaning basi hoji akoina patients sing je ICU da thamba je ICU gi si ju yamna arrive dina te masi yamna important jo ba critical care da makta do ICU da bu tham dar ga the end of the life or bra haina patients sing na zu dum family members sing nung nang ma phawa ado ICU da thambagi magi critical care gi importance su khara highlight to biu aduga ICU si ju yamna tangbo oibza la swai ju khara highlight to biu doctor
asigi question si yamna maru obe question ne ko haidi cancer gi treatment chathar pasida on the whole tang wad natana ko ICU gi care am ko na patient da dakar or pagi problem lai ko ayam da koi onco critical care hai tare ko onco gi ICU ga atopa ICU ga khina ba khara su le jai ka onco gi ICU da de koi na ayam matam da koi surgery to ro patient hai tare post surgery da surgery su achong ngak to oi ayam matam da cancer gi patient hai bas da masa hana da gi atopa atop patient sing di kitang am immunocompromised oi ba adi immunity down chala ka pa infection am prone oi gan ba dum bo oi gan adagi atopa patient khoi cancer gi treatment chatharaga chemo nung radiation nung chatharaga sudden magi organ ama so ron warak pugumba adumba patient admit to badum thingna je ko ICU da adagi atopna khoi gi palliative ta som hang bi ba jesuna hang bi palliative ki end of the life care dam thamra haibu ki question ma lai ko nach adu nachade khoi sida palliative ki oina tongana dedicated group ama leje ko unit ama leje under Dr. Nandan Chaudhary na ko mai makhada leje palliative si akoi gi hana di khane only at the end of the life care ko patient sigi yaratra bukanda when all the treatment modalities have failed ko palliative to the chathabra haibadu madu lale palliative care si akoi di hana hek diagnosis hobadagi starting from the treatment digi tum incorporate toroga chathamine hai tare ko the palliative se da koi je haining is concurrent palliative care hai tare hobadagi diagnosis hek khangwadagi ulapna loina ragadum chatminaba masi sigi advantage na kai doge habida patient the quality of life se improve to behavior adagi patient the financial burden adagi koi psychological social economic burden man su handai adagi ngasa in haijagi cancer amagi lying patap chathabada patient the nate lying we say magi family su involved to godaba from the very beginning si sina moi the burden stress hai ya aduki matik handai hai tare aduna akoi gi Karkinos study palliative ki care si akoi dedicated unit oina lejai ko aduga haurakpadaki hauna incorporate tawjai masi mayam gi mid ni hai tare ko only at the end of life care have si
masi aran ba poni khoi horak padi hona incorporate torba patient si magi end of the life lakun ka kanda ko yamna dignified way da ko yam dignified way da masagi own will da patient khara dum koi advance directive kan le je ko haidi cancer nara kansta ai ni sagi ko na khengwai matam du yok sala e haiba kan ko karam haina kamaina plan tor phajana koi DNR continuous resisted kind le adigi ai ngoda ko na tube happy ga no ICU da ko adugi mayam ama le si ma'am si patient masamang no willingly sign tor ba yai koi living will na ko or all aduna tragasu mana atop magi koi kaini surrogate hai tai magi representative oina ko aina sumaina decision lo bangam dar kanda ai gi damak decision lo bi na hai tai ko adumaina adu pau adu hai yam well dignified oina azana care pibi bedo ko magi end of the life care lap kanda adu bi face loina mak koi Karkinos le je hai tai
palliative care gi matang da zu akoi gi public na awareness kitang buat pra haina zu dum khanjai aduga but hojik Dr. Nandan Chaudhary magi me makhada yamna di magi web sisu kan di kan khalap male Manipur da doctor ni khangjading baje doctor na hojik family bhawa moi je counseling pi ba khotpa incorporate loin tawe habni na in what manner hojik ki cancer patient ki family sing je sida Karkinos ki site gi moi da kamaina ready do hanba or kamaina moi bu patient this mai na re khole maun da si thengrak pe ha ba gi challenges myam do moi da hana adapt to hanba ge si gi role ji kitang highlight tawbiyo doctor
patient di palliative care ki makhada lap bi ko palliative care ki da smaina patient se magi end of the life care kai pasagi all the treatment modalities ma'am se loina mak yadre haira kanda leiba kanda ko patient ki family sidi hobadagi to point knowledge pasana pipi raga ko adagi suppose aina hajaning the organ no haira ne oral cancer guma haira patient se koi yam bleed togan ba koi treatment modalities koi radiation togre khotgre adu erga su thing bu kaino ma adi ko na bleeding to ya khotpa adi patient sina hogat pa khotpa ngamdre adi puto pusin la ko sum ngamdre ha ba kanda koi gi team adum home visit no adum chatti ko aduga ingano last ki magi masa yam sojal pa warak matam hai tare ko adum kanda bleeding mu yam to rakan sida koi gi e orak pa e ha ba adum to kan sida imung manu family caregivers sina e ubada da koi gi sang da tuzungam painingai gumba oiba ko adum ba tholpa kan de koina sumaina bleeding mu tore khole haraga di patient se koi gi towel koi gi dark color towel hai tare ko bleeding to we khole ha kan aduna phajan bi mention bi ko habidi e do color mu chu awaw gum oiraga di e mu chu do ubada da koi gi panic to ga da ko aduna dark color gum towels na su koi gi e do tholpa ka da namjan bi pressure pb ba khotpa do erga di panic to bodo handhana ba ko habidi I say palliative care ki da when all the treatment modalities have failed ko aduga koina atopa option like tra ba ka da ko adumaina su patient counseling proper guidance ko aduga koi gi holistic way the approach to adumaina loina je hai ta.
Thank you so much, Doctor. Mathang da Dr. Thangjam Nirpendra dam lak chege. Doctor, when hoigi treatment je mai multiple steps involved or kadaba surgery kumba yaw kadaba precision radiation kumba yaw kadaba sikuma mayam je lak matam da di kamaina approach to boge doctor.
Sigi kana se wafam se hoigi cancer na ko matam da cancer ki treatment se apna sanali camera ama leiba matam da ma stabilize to na bage ko tripod am changi ko adoi to na cancer ki treatment da su samna tripod am changbu chamana yeba makhong amana hoigi medical oncology ki chemotherapy aduma dalan ta ka pa to pa ma atopa makhong amana na sai surgery ki pa andigi atopa amana sai radiation mai yabi ki pa aduna cancer se treatment to matam da ayam matam da hoji ki hariba modalities ahum se am changi surgery khatang tawga loibana taba natraga radiation khatang tawga loibana taba the chemo khatang tawga loibana taba adwain tawdana hariba modality ahum se moi changbana ayamba oibanina aduna patient amma lakpa matamda moida properly treatment holdringai da sigi modalities me am changa kani habs moida properly explain to hoba counseling to hoba ma changeba that we always do atha am patient could be no ba patient plus family members me am se no ba counseling no people ndigi patient china akoigi asain panjagi same group amada haiba modalities me am se no leibnina patient na mafam amadagi surgery dagi andigi ngasagi chemotherapy gi medical oncology gi part andigi radiation oncology part is lab na nui chatpagi kesu darkar leitrebo koi same roof ta leibnina aduna they find much more comfortable aduna moi siana comfortable oi harima constant noi fa leibnina ondigi doctor masin dasu the communication gap later and the discussion nungai ba ko patient the condition the si leibnina si tawra si habi condition sin nungai leibnina ko si process si consider noi leibin nungai ban le.
Okay, thank you so much, Doctor. Doctor, dagi among khangzaning baze mayam je patient as well as doctors magi network or magi relations yam close nitta dum laibra masi kamaina maintain tawge phone call anytime patient na doctor the clarification pam matam anytime call gum tawraga dum mi khudong chaba laibra or hospital gi side gi timely basis ta dum phone tawdana check tawraga patient gi health kum inquire taw khotpa si swise khar tham
leijai madagi kana duma aduga khoi doctor masin ge hare gati just never a communication gap communication gap am telite doctor amaga ki especially patient di matang da pau se amana amaga mena pau nei phang nei andagi atopa amana khoi gi list na sain panjaki ba tumor board aina treatment si hawra matung da hawduna da tumor board ama khoi multi disciplinary tumor board aina virtual tumor board and tawra matung da treatment se decide tawra matung da treatment se hawraga karigumba marak tu da ana apli kenjin bani khangde any akogi changes ama la ko reassessment taw matam da karimba treatment se ponga da darkar laire natraga kari decision ama law sige ha matam da su mari so koi punna mu phamina raga board tumor board ana mu phamaga mari da mu ko treatment decision se punna domina ya andigi patient gi side ta koina patient sina yum da laira kanda akogi hospital gi side issue akogi regularly adin call mena tawi follow up ki akogi follow up tawna team mamu lairi mage personal contact mena bo lawraga lai adina sila regularly phone tawraga patient gi matam da suppose akogi mage chemotherapy kaapa gi matam bu yora e natraga amu investigation taw koi matam yora recall akogi amu la aga ye follow up tawna matam yora se patient regularly matam time to time akoi noina ba amu phone tawraga noina ba akoi contact tawra lai jai sigi pot sima and the patient na karigumba hoida magi ani gim the problem ama leire ata mon the nuaitabam leire paw ma fauningi karimam hangningi haraba matan da hospital la lakpan nandraga su lakringa de waraga su akoi hospital gi moi contact number ama lei sidai sa mo contact tawraga ogi sigi through the gi tawraga akoi experts sing the mo contact sa fauna kanda man patient na nuaitab do karino haibu do aduga yarigi akoi patient na lakpan ngamdraga su da pen solve tawna bu manase.
Thank you, Doctor. The Karkinos Cancer Care Cancer Hospital Imphal is a patient-friendly environment. Adukumba leiba aduma facility leiba adum hospital ni matanga shwaida attend ba commercial brem te lojage break matungda koi expert doctor singa rapid fire round chathajage.
Welcome to Karkinos Manipur Cancer Care Institute and Research Center, the premier destination for total cancer care in Northeast India. Our state-of-the-art infrastructure offers a comprehensive range of cancer care services, from accurate diagnosis to personalized treatment and holistic rehabilitation. With advanced radiation therapy and high-tech machines, we deliver precise and effective treatments, ensuring the highest standards of care. Our team of highly experienced and qualified doctors utilizes modern technology, precision medicine, comprehensive chemotherapy, and innovative approaches to provide the best possible outcomes, making advanced cancer treatment accessible and affordable.
The Karkinos Health Center Imphal has started in full swing, and it is giving benefits to the poor patients and to the patients in the Northeast region, especially in Manipur and the neighboring states. And we are giving it at a very affordable and a low cost price, and also accessible. So affordable and accessible care for the cancer patients is the motto of the Karkinos Institute here in the Northeast.
Our multidisciplinary teams, tumor boards collaborate to create personalized treatment plans, ensuring each patient receives the most effective care. We prioritize patient well-being, providing emotional and practical support throughout their cancer journey.
These days, yeah, hospital Pasok na mo dino. Ay na thyroid cancer laibadagi ay Karkinos asida yengjaba lakhibani. Dahanbada aina sigi treatment tawala koda yamna capable weba Dr. RK Gautam Jit ka thengnare mahangna aibu layeng bidana hojikti aigi cancer gi layamba cell dusu lokthokpigre aduga hoji normal dabudi laijare.
Karkinos Healthcare. Care for your loved ones for a healthy and long life.
Break matungda amka hana taram nokchari. Doctors, now let's move on to quick fire round. So here I'm going to call out a common symptom and then or a scenario which we often worry about, and doctor can kindly explain what is it about in about 1 or 2 minutes max. So when is it an immediate warning sign to see a specialist, and when should we stay calm and not to panic? So first I would like to come to Dr. Thangjam Nirpendra. Your first question: a painful mouth ulcer or sore that pops up after eating something spicy. Akoina kariguma matsara matungda chinda ulcer thokpa pom thorakpa ado masigi scenarios.
Akoina pakhatkadaba condition khara lay natragana pakhaloidaba mako. Chinda ulcer ama laiba habsi karigumba akoina laihu gumba tawkiba lokuma thungba natragana akoina laihu tawkana immunity sondharpa matamda he akoi pokthok chin pokthokpa ina lay pokthokpa mi yawi. Naraga kemcha vedaba thuptana leba adugumbatudi ayamba matamda it heals by itself hapta amani is days da noina wakil tawjai adu sindidi akoina thoni yam kana pakaningai oide adubu karigumba lai gumba says da akogi aksang khanaugi kana manung sidais da chathatana leiraba ulcer ama leiraba it is painless ko hawpa matamda nadaba ulcer ama leiraba painless ulcer leiraba, but it does not heal ko heal to yadraba hapta ani hum sidais da adu itadi mari akoina section bam chang cancer.
Thank you, doctor. Painless ulcer. The second question, doctor: a hoarse or changing voice after a bout of bad weather or flu. Khanaugi voice kumba change after a flu kumba naru matungda masi chingna ningai oibra, doctor.
Consider habsi akoina lokumba tunga kandasu masi kanatawi consider yawi and the Lena Tagi Natabida akoina me and a voice and I'm seasonal singer gumba, say I'm the teacher Ozagumba con the sports and I'm not coming loud conto ragasu, Matamgra consider, but other guessing to the voice rest of Kanda Yamban Pagalakani. Other book Karigumba, high racing say out with the consi seedinusum la ava, Matam Sana, Sidana la ava, Pagalatrava, Adu Taragadi, Madigi Portsima, Aquina, Yankton Bumson, consi, the sea, a quiggy, vocal corta, vocal quiggy canogi magia. Cancer malaria natraga nodule malaria natraga even lung cancer itself moinasu consider
Thank you, doctor. Aduga home super question: noticing a dark mole or spot on your skin that seems a bit dark. Koina sambru di ma sambru degi hena muba ma thingna batara gadi masisu chingan ngai oibra.
Sambru si karigumba akoida hana degi thaina degi sahi amani ka like lisang sina lerba sambru oitara gadi karigumba hongba leitraba madu yam kan kiningai oide. Tagudabu, Karimba, Nauna Tolapa Sambru, Nataka Hana Leramba Sambru, Izaragasu Karimba Madu Saukal Ava, the border Akoivasi, Akogi diffuse awareness, Kinziga, Puras, can demarcate our late, but not Tavako, and the Gis Sagi Sambru the Machu Hongapa, Sambru the Gi Tolapagumba, Hagazaraga, Rugumba Lerapa, the Sambru Koibada, Masamasa Sambru, and over Song Topalera Taragadi, Masia section Gadavani, Yankson Bamasang. Skin gi sambru gi oiba adugumba makal melana ma ha cancer makal malai adugumba to oibra ha yamba mucha.
Thank you so much, doctor. Mathang da Dr. Thingujam James Lakchage. Doctor, finding a lump or experiencing pain in the breast.
Usually akoina breast apomba malaiba amasung nabase. Some hakanda usually period ka nupi oibida di period ka Sagona hai period matamdaga naba khotpa tawbasidi kaisu akaiba leite na pai aduga hana apomalisu piaga leiba hana disang sanga leirakpa hai tare paibada sabna kan nadaba or akanbo oina form oina oidrakanda ti kaisu ka tawdi aduga suppose hojigi pochina khangchau chawkhalapagumba oiraba adagi sabna kanda koina breast gi nipple discharge gumba lakpaga oitaraba adu oitargadi doctor matang tokuma thok tai na khal.
Okay. Thank you, Doctor. Aduga anisuba wahangna feeling bloated or having gas after a heavy traditional meal. Saksa yam chasal malor kana pukse yamna bloated feeling to was masi.
Usually bloating to hai ja koi kaino ma heavy meal gu macha ro dum bloating to wa dum tong nei ko adu tawraga su sam nai kan da koi usually karam kan da kaino to ge hai ta dum kitang dang char ga dum bloated to dum leiba hai ta aduga le sang sit na hai de kui na hai ta pukse dum itana thalal lei he ga hai do
Yam chadraga su.
yam sa adu main to gon ba se kai bu kan da koi gi ovarian cancer nupi gi da hai ovarian cancer gum ba he koi gan ba yawe ko adu gi symptom hai ta re ko bloating adum to le se da gi sam na kan gi gi cancer gum ba da su adum theng na ba yawe aduna normal le koi gi cha ro ga heavy ga sa ro ga adum ngala ga phab du gi su kai din na tan le sang sin na hapta ma tham ka se du tham ni ga se ka hai ta re tang tang sa ra ga su adum ithan da thal le bi type to do adu itari doctor um to dan to
Duga Doctor Gia Humsubo Hangna spotting or a little bit of irregular bleeding between normal menstrual cycle. When you tag him ka plak bazigi mark normal cycle ke manung da e spotting kar thing na bata dia koi section masi is it a warning sign?
Sidasu sam na ga di akoi na spotting amurakum ga theng na ba hai tare yam hangai kem to dra amurtang ga theng na boi tar di sam na ga na hormonal changes pu egera stress pu egera hai tare aduna maram oira kitang u basi tum yaune ba adubu repeatedly or frequently hadam toina intermenstrual bleeding the spotting urakpa ko adai samna ga postcoital bleeding urak taragadi kai lege haibadu ma kupna thigatum thoktai kai ginoi ta usually endometrium uterine cancer gi endometrium gi cancer umba oigan busu hek yawalle postcoital daga oiragan angang haumachin gi cancer ga hek oibiyawe aduna maina yeng thoko phai or otherwise akoina khamba loigra matungda haitaren nupi na khamgra matungda chahi ma pra khamgre haire aduga maraktaga drop on tangju lak oi targadi aduma yeng thoko mathok tai kai leige habduma kai ma adu poche samna postmenopausal bleeding ase magi symptom mamani endometrial carcinoma gi oibagi symptom mam oibanina aduma yeng thoko mathok ta gani kai leige underlying we should not ignore it aduma.
Thank you, Doctor. Thank you so much. Next, I would like to come to Dr. Pallavi Mehta. Your first question is, a small tender swelling under the jaw or in the neck during a throat infection.
Okay, so if someone is observing a swelling in the neck and if it is associated with sore throat, cold and cough, normal viral infection, and if it is getting subsided within 2-3 days when the fever has gone, or if you have taken some antibiotics and the swelling has gone, it means nothing to panic. So it is just related to the infection, and do not panic, sit at home, you need not to see a doctor. But if the same swelling is painful, if it is increasing in size, it is becoming hard day by day, and it is not subsiding over the weeks, and there is no fever, you have taken antibiotics, still the swelling is there, so please you need to go to see a doctor, and you might need a biopsy also for that lymph node.
Okay, and the next question is losing a couple of kilos after starting a new diet or a busy month of physical work.
Okay, so if you are losing weight and if it is intentional, you are doing a lot of exercise, you are going to gym, you are doing yoga exercises, and you are taking care of your diet, then nothing to worry. It is just an intentional weight loss, and whatever you are doing to lose your weight, it's working on you. So but on the other hand, if that weight loss is not intentional, you are not trying to lose your weight.
No exercise, nothing, but
yeah, with no exercise, no dietary restrictions, still you are losing weight. And if it is a significant weight loss, like 5% weight loss in over the 6 months, your clothes are getting loosen up. So that's an indication that you should go and see a doctor. And especially if it is associated with fever, night sweats, lot of fatigability, then definitely you should go and see a doctor.
Thank you, Doctor. Doctor, takui baze koi na hakchang ge koi weight se khakan handa bata ga di aduga fever, night sweat ga associate tawba admai thingna bata ga di doctor da tana bi ho haiba do thambi bani. Your next question is, Doctor, a sudden spike in fever that goes away after taking paracetamol.
Okay, so if you have a fever and you have taken a paracetamol and it's not coming back after taking paracetamol, most likely it is nothing to worry. It is maybe some common viral fever, and you need not to worry about that. But on the other hand, if the fever is persisting, despite you have taken a paracetamol, but fever is coming back after every day, every 1 and 2 days, and that fever is associated with other symptoms like extreme fatigability, weakness, some bleeding spots on the skin, rashes on the skin, or bleeding symptoms from any other sites, that means you need to check your complete blood counts. So it could be related to the hematological malignancy, and definitely do a CBC count and check with the hematologist.
Doctor na takpibasi akoina fever se adum hidak chargasu adum hanjan adum fever yam toin toksalaba aduga akoigi blood spot kumba thengnaba sikumba thengnaba targadi doctor tana biho haina thabibani. Thank you so much, doctor. Next I would like to come to Dr. Konzam Jina Devi. Your first question is suddenly feeling dizzy or faint after skipping a meal or standing up too quickly. Chakcha da bagi ko nga wo idera masi akoi chingan ngai oi brado.
Visit summer matam sula eko matam siga dum chane koi ising gumba yam thaktra dehydrated oi bakan da su sumba conditions dum thing nei ko adagi amana koi gi chak cha drakan da sudden drop in the blood glucose level ko hypoglycemic episode chatpa this is especially in a diabetic patient gumba da dum ko or ngasai gi kok ngau ba khangai hai da bu koi gi bp khang nem nem dharak gumba koi si orthostatic hypotension hai adum ba se adum thing na ba yai ko si hoji summer lak matam sida ko ado koi na karam haina prevent to kadage haibada koi chaba khopasti koi small frequent intervals ta kitang gap regular naina chabi ba ko adagi hogat pa khop matam da koi tumam badagi oire phukla hogat pa se koi bp sudden drop to ba ko adumai to ba zum thangale koi ahing da koi mapan to ke kain hogat pa da su sudden mi se collapse to ba yawe ba ko adum ba se ka to gap da koi ko ngau ba hairak pa adumai to ragadi Pamungi mapanda tapna hogatlaga phambiba aduga tapna hogatpiba khoi khangho he hogataba ko suma se tobiba phayena khale ko adagi sugar wangami da khoi blood glucose down chapa kanda gyan khawang mang ba yai ko adum do sugar gumba check tobiba aduga khoi my regular intervals chana ba khar khar dum ko small frequent intervals pibiba suma se mathau tai na khale bp wangami da bp regular medication cha ba cha dabra na check tobiba adumaina dum se mathau tai na khan
Doctor, see the rapid fire question in achadre, but just in addition, Haizabatare, Karkinos Cancer Care Hospital is only cancer patient katang yang bara natraga all other different kinds of ailments so dum yang bara si jo kitang kambir.
Akoi se di kena tawra the cancer patients the mainly dedicated cancer dedicated hospital ne cancer ngak tagi oine yeng ko.
Okay. Thank you, doctor.
The non cancerous over the su lak pa yawe hoi margin ukoi keno ina whether cancerous over non cancerous over ko matang da sulak pa yawe yeng bu dum yawe adubu mainly dedicated to the cancer haitare.
Thank you, doctor. Your next rapid fire question is: a person suddenly choked while eating or started coughing weakly and was unable to breathe. Hari cha matam da khudakta dum panba khutba tawse
phunba panba adum ba so ko si su dum khoi scenario dum thingna ba dum yaw jai ko sidai sida khoina yam thuna chaba ko yam thuna chaba wangang with the chak cha na cha ga no kaina khoina haini se asida sumba case dum thingna ba yawe ada makhan ani sui partial choking hai bam ga ko adagi full complete choking hai bam ga partial da na khoi gi ngasai gi khoi gi soron be gi airway gi passes ai tare si se kitang partially close oiba adum kan da patient se amatam da mathan da lok ti khuba ngam ni ba ko adagi ma adum khoina hai ba ko breathe soron do ko ba duloi ngam gani adum matam da khoina karimta to bada ka ta de just encourage the patient to cough up lok to kana kana khulna ba encourage to biba aduga condition am lai pura full choking to gi ba hai tare ko adugi universal khoi gi choking sai na ma khut sina khut either one hand or both hands ko sisina smaina khut na manga kham sila smaina paija ba hai tare ko aduga patient si khoi almost khoi gi blue machu jangsalak pa so hon bangam da ba wang nang bangam da ba lok khu bu sungam da ba adum ba condition thingna ba yawe ko adum badana khoina tongan ba maneuver khoi gi Heimlich maneuver hai ko khoi gi patient si gi maning wai tang lepa ga hai tare ko aduga patient si gi abdomen mapa khoi gi sida khoidou mapa leise ko khoidou si gi kitang hek mata ka khatlaga khoi gi Heimlich maneuver na khoi gi khut sina sumaina tasalaga hai tare khut amana ko aduga fist oina khoi khutum tasalaga khubi sina pukom da sumaina inkhat pa ko aduga another hand sina aina maning nom de ki lepak to ni patient sina mamang nom de lei to ni ko aduga ngasai gi khoidou gi mathak te gi hai tare ko kan abdominal thrust se mangarak piba ko mangarak piba adagi maning nom de gi su khoi back blows na ko agi khubak sigi khunam hai tare sigi kidasna sisna khoi shoulder gi blades da lei ko sigi marak sida mangarak piba 5:5 to piba maning dagi mangarak dagi mamang dagi ngasai khutum tasalaga to bose mangarak piba ko si se khoi Heimlich maneuver ko koi na choking to bokanda sigi immediate kano se adi patient bu magi no tong na ba recover tong na ba hai tare ko adu da sometimes patient mana palli ba poto pai thor ko dum yawe adagi sidagi hena yam henza lakta na hai tare patient se gyan mangi ba khot ki ba tawr ba ko agi so ho laktra ba adagi kano tawdra ba mi hun yaw ta ba khot patar ba de ko dum CPR dum perform tawgani ko
Immediately doctor the rush to tare
rest of the
hospital adagi doctor gi third question an elderly person develops sudden weakness becomes less responsive or starts breathing rapidly at home
sisna koi ahal labanda ko de kangle smina sum leimina madagi khangson sonjalakpa makhut masa khongkhut loinwa sonjalakpa adagi soron ba se khangwa waraga adagi gyan mangi ba unresponsive oigi ba ko adum ba kanda koina kai to gada ge have se koi elderly patient ni chahi yama banina magi hanagi hypertension sugar ko gi problem diabetes adagi atopa heart ki disease mayam ama leiram ba yai ko aduna koi to oibe abase stroke to ba yai heart failure heart attack to ba yai ko condition mayam ama leire adumba condition da koina kai dogada ge have da patient se hana koina magi response hani yengani ko phasana gyan lei ibra ko ibra have do gyan leite khote ko buda keno to de ha ka de koina dum emergency gi 911 di dum ko grani ko aduga patient se koi gi sordi hon ba ko ko bu ko bada phasana response of the sordi hon ba ko adu oiraga di mi hun nung loi leire ko le ha ga si koina koi recovery position ana le patient se koi gi lateral da koi di upaga ko khong makha thang khong sina sanga thamaga opposite ki khong sina mathak nom ta cancel lak pai tare ko adu khuchna rest oraga koina maya magi mouth opening se yenga cancel ko gi angdoga source gi lambi se phajana chat bras me yengam da ka oi sometimes ko de gyan mangwa patient da ko gi lei sina konchal laga ko gi airways obstruct to go yawe ko adu do open up to ba mai du khadang se thangat laga ko gi so ron gi passage se phajana chat ibra hai bu to me yengam da ka oi patient di dum mi hundi yawi bani response to phajana tawde hai ba wa ka tanish masai so holi bane aduga aduk matam da mana khara gyan la ekhole haira gadi phare ko adagi khoi sugar wang patient ore sugar gi yengani bp wang ba khole bp do suddenly down chat lam be hai kari to buno ko puna ha du ma yengani ko at the same time khoi 911 di ko grabane ko adagi sidagi mu patients na mu keno to dana henzal lakta na hai tare ko khoi gi sor hom da su holaktra ba lekraba khoi gi mi hun su yarok traba yarok ta ko de khoi gi dum CPR se dum nambi gani ko aduga meanwhile da dum khoi gi healthcare khoi ambulance ki hai tare ko adu higher facility hospital pukhat pi batai adu phajana proper check up torma ma thau tare
irrespective of whether elderly person do cancer
elderly
patient
oidrasu sudden weakness sudden ko di mangoda sogram ba wa ba ko adu maina gyan mang gi ba khot ki ba thok la ga di maina adu hospital facility de phukhala phajana proper work up to gom la ka
Okay, thank you so much, doctor. Thank you so much. Aduna ngasigi from today's discussion, there is one thing that we all need to remember. Madudi karino harga early detection save lives. Aduna cancer laina or any laina je hoi nang tana detect the hoba targadi magi laing patap sathaba dagi punsi kan bada yam chawna mateng pangi habjing ngasigi discussion sina yam na mayek sing takle aduna chinda ulcer am thokpo gera natraga koi fever je hanjan na fatraba aduga fatigue leiraba aduga adum blood clotting kumba leiraba doctor mayam ama koi rapid fire rounds raise the mayam ama thamgi ba karam kana chingna ningai oi karam kana doctor approach tawgani haibase yam mayek singna thambire aduna early detection is everything haizabatare and for the first time mayam je akoi gi singma chingna ba like ba matamda akoi gi Manipur maktada leiba cancer gi hospital or ba Karkinos Cancer Hospital Porampat leiba hospital gi facilities mayamna khudong chabs logi ba yagani khoina any patient kano appointment loading batar gadi phone number ani khak thamjage han bada 87875 23654 among han haizer bada 87875 23654 natraga 700 575 3510 amuka han haizer bada 700 575 3510 number ani asida isra call to biduna appointment lowi ba yagani nasi akogi discussion sida mapung fana sarugya bikiba akogi doctors ahamada Dr. Thangjam Nirpendra thank you so much Dr. Pallavi Mehta thank you so much Dr. Tingujam James thank you so much and last but not least Dr. Konjam Gina Devi, thank you so much for all the insightful discussion and enlightenment that you have brought to our viewers. Thank you so much once again. Nasigidi Karkinos Cancer Care Hospital gi Dr. Singa Smaina wari watai sanaduna cancer gi matang duga lying pathap ki matang duga facility gi matang da khanajabasi matang shoi lusinjaragi. Thank you.
From its inception, Karkinos was conceived to try to tackle a really big problem at the scale of all of India, trying to find cancers in populations that historically have not been screened for cancer using conventional methods, but really jumping over those historical approaches and applying new technologies, digital tools to allow patients to be risk assessed and undergo screening with available methods, as well as blood-based early detection methods, currently still under research, navigating those patients to care environments, and applying the very best molecular diagnostic technologies so that patients can pursue the very best treatment for them. It's this vision and the assembly of teams and technologies to really cover that entire broad domain that I find not only inspiring, but really unprecedented anywhere else in the globe. I think many of my colleagues who've enlisted in this effort as advisors, we do it because we see the potential impact in India and how the Karkinos model can be scaled and actually deployed in other geographies as well.